Bismillahirrahmanirrahim. I am Professor Dr. Atif Kazmi, HOD Department of Dermatology and Dean, Institute of Postgraduate Medical Sciences, University of Lahore Teaching Hospital, Lahore. Today is the World Albinism Day, and I have my dermatology department with me. Dr. Aisha Malik, who is an assistant professor, is sitting on my left. Dr. Izza, who is a PG in Part 2 FCPS Dermatology, is sitting on my right. And to the extreme right is Dr. Ikra, who is a PG for MCPS. And on the extreme left, we have our HO, Dr. Ifra. So, due to the Albinism Day today, that is June 13, we are also celebrating, that is University of Lahore, and with the efforts of the principal, Professor Dr. Mavish Arooj, our Pro-Rector Health Sciences, Professor Dr. Shahid Malik, and our Associate Dean Dr. Sikandar Afzal, and our MS Dr. Zahid Pervez. I am very grateful that we have been honored to hold this World Albinism Day, as it is being held all over the world and globally today, that is June 13th. As you know, that albinism or albinos is a disease which is worldwide present, and ultimately some people think it's a curse when you have a child in your family having albino or suffering from albinism. The only problem among the Pakistanis or our culture is that we get married among ourselves, that is consanguineous marriages, and ultimately these cousin marriages may lead to this autosomal recessive disease which is known as albinos or albinism. I would request the audience, whoever sees this video later on this World Albinism Day, that we should ultimately avoid getting married into the families and cousins. This is very important. Right. So, as it is the World Albinism Day, and I have told you, now what is the background of the International Albinism Awareness Day? In the mid 2000, reports of violent attacks on and murders of people with albinism in Tanzania was reported. Beliefs that albinos had magical powers, so they were preyed upon for parts to be used as lucky charms and in occult rituals. Human Rights Council on June 13, 2013 adopted the first resolution ever on albinism and recommended June 13 to be marked as International Albinism Awareness Day. What is the history? 17th century, first time term albino was used in Africa, which means a negro. Albino, complete absence of melanin. There is no melanin at all. So albinoid, diminished amount of melanin. So whenever we have absence of melanin, then we can term that person as an albino. What is albinism? It is a congenital disorder characterized by complete or partial absence of melanin pigment in the skin, hair and eyes, due to absence or defect of tyrosinase enzyme involved in the production of the melanin. Now, epidemiology, international average is 1 in 20,000 and affects all races, also observed in animals. Oculocutaneous albinism more common in Pakistan families due to consanguineous marriage. As I have already mentioned, that cousin marriages should be discouraged. OCA1 is the most common OCA type in Pakistan families, followed by OCA2. Pathophysiology. What is the pathophysiology? There is deficiency of melanin biosynthesis. Melanocytes normally present and distributed are obviously abnormal. Melanin synthesized from amino acid tyrosinase is also one of the cause, and it gives skin, hair and iris its natural color, which is obviously the melanin. And we have a graphic representation also that how the tyrosinase ultimately is converted into eumelanin. Now, types of melanin. Eumelanin is known as black or brown color. Pheomelanin, red or yellow color, red hairs and freckles. Neuromelanin, brain function obscure. Eumelanin is the most abundant melanin in humans, most likely deficient in albinism. And there are two types of melanin, that is pheomelanin, yellow to red in color, and eumelanin, dark brown to black in color. Now, benefits of melanin: protection against harmful effects of ultraviolet rays of sun and sharpness of vision. This is very important. We are very lucky that we brown race have lot of melanin, and this melanin ultimately provides and protects us the sun exposure that we can have ultimately from skin cancer and ultimately melasma, pigmentation, and other pigmentary disorders. What are the genetics of albinism? Most types inherited as autosomal recessive disorder. Some types are X-linked recessive. 7 genes are presently linked with different forms of albinism. Genetics of albinism, how autosomal recessive alleles are inherited. Father is a carrier, then mother is a carrier, then ultimately the genes are there. 25% may be unaffected, 50% remain as carriers, and 25% may be affected. Now, types of albinism, oculocutaneous albinism, which is very common in Pakistan, affects the eyes, skin, and hair. White, pink hair, skin, and hair iris color is changed. The vision problems or photophobia is there. Ocular albinism is affecting eyes only, skin color normal, no pigment in retina. So these are two types, oculocutaneous and ocular albinism. We generally see more of oculocutaneous, having cutaneous manifestations. Clinical feature, skin and hairs become pale and patchy. There is a white skin, and the eyes there is impaired vision, photophobia, strabismus, nystagmus, and retinal problems. Now, what is oculocutaneous albinism type 1, which is the commonest in our country? Tyrosine related albinism results from a genetic defect in TYR gene. OCA1A, the enzyme is inactive and no melanin is produced, leading to white hair, very light skin, and no tendency to tan. OCA1B, the enzyme minimally active, small amount of melanin produced, blonde seen in blondes, yellow, orange, light brown hair, severe visual impairment. Oculocutaneous albinism type 2, defect in pre-protein helps the tyrosinase enzyme to function, minimal amount of melanin pigment, less severe than type 1, red hair, creamy white color. In sub-Saharan African and American and Native Americans, this type is more commonly seen. Oculocutaneous albinism type 3 affects dark-skinned people, Southern African blacks, mutations in TRP1 gene protein related to tyrosine stability. Rufous red albinism is less common type of OCA, reddish brown skin, ginger red hair, hazel brown iris, milder vision abnormalities. Then we come to type 4, common among East Asian populations, similar to those seen with type 2, mutations in SLC45A2 encode membrane transporter in melanosomes. Oculocutaneous albinism type 6, mutations in SLC24A5, defective protein related to proper maturation of melanosomes. This is the chart which is showing you, and these are the different types, but we are more interested in OCA1A and OCA1B, but the rest of it are not generally seen in Pakistan. Other related conditions of albinism, Hermansky-Pudlak syndrome, it is hereditary disorder, albinism with visual impairment, blood platelet dysfunction with prolonged bleeding, and lung fibrosis. So this is a syndrome which encompasses the other systemic organs as well. And there is another important syndrome, Chidak-Higashi syndrome, mutation in CHS1 gene, lysosomal trafficking regulator, OCAs due to OCA, prolonged bleeding, easy bruising due to platelet abnormalities, pyogenic infections, photosensitivity, nystagmus. Neurological manifestations are intellectual decline, cranial nerve palsies, and tremor and seizures. Griscelli syndrome, another syndrome, partial albinism, frequent pyogenic infection, acute episode of fever, hepatosplenomegaly, neutropenia, thrombocytopenia, hair silvery grey, silver greyish golden. Cross syndrome, generalized hypopigmentation, white silvery hair, severe mental retardation, and spastic tetraplegia. Albinism deafness syndrome, partial albinism, congenital subtotal sensorineural nerve type, and hypopigmentation, diffuse or piebaldism. There is a unique albino village of Bhatti tribe in rural Sindh, Pakistan, with oculocutaneous albinism manifestations. So this is very interesting. A unique village of Bhatti tribe in Jakbabad district, Pakistan in Sindh. 40 children and adults with albinism live there. About 65% of the affected individuals were younger than 16 years of age, and the reason again is consanguineous marriages, cousin marriages. We have photographs. Here you can see these photographs. This is that family. Then I'm showing you the previous photograph, skin problems in albinism, Most important, easily sunburned, increased chance of getting skin cancers, BCCs, SCCs, malignant melanomas, and squamous carcinoma. Treatment of albinism, photoprotective measures, clothing, sunglasses, broad spectrum sunblock, SPF 50 or more, regular skin examinations, and especially for cutaneous malignancy. Thank you very much for your attention.